In our revised HIV prevention and treatment guidelines, the Ministry of Health will treat all HIV-infected children below the age of 15 years.
Regardless of their symptoms or immunological status. In this new era of communication, other countries have followed.
The revelation came as the 7th National Pediatric HIV Conference got underway under the theme, Stepping Up the Pace Towards an AIDS-Free Generation. Every adolescent counts.
We lump adolescents with adults, and this is wrong. We need to count adolescents as adolescents.
The only group still reporting increasing number of new infections and deaths.
According to the UNAIDS country coordinator, only 43,000 of the 193,500 children living with HIV under 15 years have access to life-saving antiretroviral drugs.
Why the children should be denied access to services?
At the end of June, we have about 51,000 children. Our scale-up plan is to really accelerate care and treatment for these children. There was a problem at the beginning because especially among children, the drugs for children never came on market as rapidly as we had for the adults.
Dr. SABRINA, who is among the first in Africa to set up a dedicated clinic for adolescents, worries that many children could continue to be infected if HIV testing is not scaled up.
We still have challenges of older women not coming to deliver in hospital, and also not every single woman gets tested for HIV.
You have had voices coming up to say, we are making HIV testing compulsory.
How would we put anybody on treatment if he or she has not tested for HIV?
Elimination of mother-to-child transmission introduced in 2012 by the ministry has helped to reduce new infections in newborns from 28,000 to 8,000.
Prevention of mother-to-child transmission became a reality for many children in Africa and other developing countries because of Uganda's leading the fight for HIV.
The Ministry of Health is now set to scale up early infant diagnosis, EMTCT, as well as pediatric and adolescent care services.
On behalf of Parliament, we are committed to doing whatever is possible within our means to ensure that the necessary laws, the necessary budgets are made to support the campaign.
The establishment of the trust fund is definitely a way forward. Uganda should not continue to depend largely on external resources.
If there's anything else you want us to do as Parliament, I'm committed 100%.
We're working with our partners, and UNAIDS, as you must have heard now, is having a global target of ending AIDS by 2030. And we think Uganda should be on course to do that if we keep
Florence Talimba, NTV.